Okay, so let's have an overview of using positions and movement in labour and what difference that might make to you. So it's questions that always come up, and there's much more of an awareness now about the importance of positions and movement, but sometimes people aren't really sure what that means. Like, do you have to be on the go all the time? Do you have to completely avoid the bed? So I get lots of questions about all of this. And to take it back to the message running through every single video I will do is it ultimately is about what what makes a difference to you, really, and going with the pattern and pace of your labour where you're more comfortable. So if there's no reason for you to be on a bed and you don't want to be on a bed, then you use different positions and go with what feels right for you, which could change throughout labour and for birth, depending on how long it is and just what your needs are. Um, it can also be that, unexpected things could happen. Is maybe you're quite comfortable on the bed. That could have a message of safety for you because of its familiarity. So it's about making that work. It might feel like there's not much of an alternative if there are medical things that are needed. And that's fine if you're comfortable with that, if you feel that you've explored options, but it could still be a place where you could explore more positions and using gravity, especially for birth. And that might feel really important depending on what the progress is of your baby being born. If any of that feels slow, can your position change to make a difference? So some of this, as I've put here, is about listening to your body. Really, overwhelmingly, not overthinking it and just getting into the positions that feel right and comfortable for you. And this is why labour and birth can be different for every individual woman, because what feels right for one just really wouldn't work for another. I've been in labours with women where um, they'll have tried a position, one of us has suggested a position, and it's like, oh God, no, I can't, I don't want to do that. That's not working. Or has been in a more lying down position because she's exhausted, has a contraction. Oh, I really need to get up. There's a real strong sense of urgency to change something if it doesn't feel right in labour. So being upright gives you gravity, and gravity can be crucial for this because it's about the position of your baby in the womb and as they move down through the birth canal, through the pelvis, more importantly, and down through the birth canal. So gravity is your mate, and that can make a huge difference. If you're off the bed, you have more freedom to move as you need to. You can still move on the bed, but you might have to think it through a little bit more, and the options to you might be more limited, but there are still options. Depending on how long labour is, there may be a real need for rest in between contractions. So with a contraction, chances are you will want to be more upright, to move, to sway, to have gravity. And then in between contractions, you might want to completely flop and rest. So positions that allow that to happen could be really useful. So that could be on a bed, that could be leaning against or using a ball or a chair, just different positions. And what I would say is trying to practice some of this in pregnancy makes a huge difference. And there's going to be, I'm going to make a video that goes into positions in much more detail so that you can kind of practice some of this, because what we know and what I've seen is that we're more likely to use positions if they're more familiar to us. So in order for us to feel kind of quite safe and comfortable in labour, we will go with what's familiar. And using different positions in pregnancy and using things like a birth ball means that it becomes more familiar. Therefore, we're more likely to feel comfortable using it. If that hasn't been part of our preparation, we might be more hesitant and not willing to give it a go when we feel quite vulnerable and in a new place in labour. So having movement and having gravity means that your body, so your pelvis essentially, can expand a little bit more to give your baby all of the room that they need to make their way down through the birth canal. So positions can be really important with that. And sometimes babies need to move into a better position because they're more back to back. So being led by what feels right for you can make a huge difference. And just going with what feels okay. If something doesn't feel okay, it's really important to speak up and say that something's not right and that something kind of needs to change at that point. Let me just stop sharing this. So sometimes, to do with baby's position, you will be guided to use positions, including to rest, so lying on your left side. Positions are like leaning forward to create a bit more of a hammock to encourage your baby to turn. So there will be positions that your body will kind of encourage you to get into that will feel better. So try not to fight with that. Just go with it. And hopefully that means that your baby then settles into that better position. But you can't go far wrong listening to your body so that you can rest. And so you can feel as comfortable as possible in labour. And that's where labour's different for everybody, because you have to say what works. We can't be prescriptive about this because women need different things at different times. So try to feel comfortable with being at the centre of it all and being at the centre of your care, so you can work with your midwives and your birth partners to kind of get the support that's right for you.